ultrasound as a modality cannot assess gastric ulcers. I've seen very many request forms, rule out ulcers. You do the scan, especially if you work in a private clinic, because your boss might be mad at you if you refuse to do the scan. Well, technically, you're right if you said I'm not doing the scan because the scan is not beneficial to the patient. But remember, this is a private clinic, and you have to deal with political questions, like the revenue is low. Some of us have had to answer such questions. It's weird for us, technically, to be answering weird questions because that is unprofessional. To do a test for a patient where they're not going to benefit. But those will be ethical challenges that you're going to deal with when you start practicing. The pancreas we talked about, we have the head, which is the lowest point. If you are drawing straight lines through here, and the first straight line will be through here, the left arm of the portal vein. Another line will go through there below, through the right arm of the portal vein. You continue down, you continue to this level. You have your picking, the body of the pancreas and tail. You continue down, you're picking the neck of the pancreas. You continue down, you're picking the head of the pancreas. So if you put your probe straight like this, you're going to be picking bits of the pancreas. You may be able to see body, tail, or if you move further down, you can be able to pick the neck, but you're missing the tail. If you move further down, you're going to pick the neck and the body, but you're missing, the head and the neck, but you're missing the body and tail because of this orientation. So if you are doing a true assessment of the pancreas, if you wanted to get it in its long axis, your probe should be oriented or dipped in this fashion so that part of the probe is along this, okay, this orientation, like that. Not straight like this, but like that. That's how you can pick the entire pancreas head to tail. So because the pancreas lies posterior to the other two organs, the stomach and duodenum, which are gas-filled, imaging the pancreas is problematic. If you're scanning a patient who has not yet eaten or the one that has fasted, it's easier to see the pancreas. If not, two things can help. One, ask the patient to take waters so that you displace that air. The second is change patient position. Either they come into a semi-erect position or erect position or some kind of decubitus so that fluid can push away or the gas can move to another location and you'll be able to assess this area. Again, we are going to get to the pancreas as an organ and we'll deal with its technique. For now, I'm just giving you tricks here and there for overcoming problems. This is one of them. The patient has changed into a semi-erect position. So the air that was previously here has moved on to this spot. Now you can be able to pass through here and see your pancreas. This is an image of the pancreas. If we were to label it, this is the pancreatic head, this is the neck, this is the body, and the tail. This is the splenic vein, superior mesenteric artery. This is your aorta. This is the left renal vein, left renal artery, spine. This is your IVC. This is liver tissue here. These are the muscles, this hypoechoic area here. These are muscles of the abdominal wall, subcutaneous fat, and then skin on the outside. Here we have bits of the pancreas being obscured. Here the entire head is obscured. Here we can see this is the only pancreatic tissue that's visible. And then we have here gas pockets shadowing. Here we can see the body and tail, and we cannot assess the head. This is the pancreatic process, we can see a bit of it. And this is the neck also, we can see a bit of it, but the head is completely obscured. So if there was a mass here, and masses are common in pancreatic head, you will miss it. Then we come to our spleen. Our spleen is located in the left upper quadrant, posteriorly, and the hilum faces medially. The upper zigzag or tortuous vessel in red is the splenic artery, and this one in purple is the splenic vein. This one, together with the superior mesenteric vein, form the portal confluence or form the main portal